Welcome, everybody, to take part in the iCON Chinese Health Forum. How's everybody doing? I'm Barbara Ho. First of all, I would like to do the acknowledge of land. We would like to acknowledge that iCON office is situated on the traditional, ancestral, unceded territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. I would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. I am the Chief Nurse Officer of iCON Chinese Health Forum, and I'm the MC of today. Welcome, everybody. Welcome to the 2021 Virtual Chinese Health Forum. Take care of your health, Dementia 360. Give it a try, and later on, there will be different poll questions for everyone. And if you are joining us the first time, I would like to briefly introduce what iCON is all about. iCON is being initiated by UBC Digital Emergency Medicine. The main idea is to assist multicultural and indigenous citizens and patients and caregivers to optimize chronic disease prevention and self-management, and to provide reliable and relevant health information to citizens. We not only would like local citizens to take part, we would like to present such health information to further remote or even overseas people, so that we can work together to improve our health. And today, the topic is Take Care of Your Health, Dementia 360. Yesterday, actually, we already had held the first part. We tried to know what dementia was, what the symptoms were, what is early detection important, and what treatments could be offered. And today, we will look at, can diet prevent dementia? Food is very important to Chinese people, so this is something we can look at. And also, we look at the mental health of caregivers, because usually it is 24/7 taking care of dementia patients. So let us listen to the experts. Another thing is home safety. And also to learn what is community resources, what can we do to have planning, what are pre-arranged advanced planning, and there will be different experts who will be speaking on these topics to us. Without ado, I would like to introduce our first speaker, Dr. Tigerson. This is his topic today, mental health tips for caregivers of people with dementia. As caregivers, when should we ask for help? So Dr. Yang, time for you. Thank you, Barbara. Thank you.
Health iCON to give me another opportunity to offer my insights with you, and I hope everyone will have a good rest of the weekend, and welcome to this forum. And yesterday we have talked about a lot of we have given you a lot of image about dementia, so we now look at this issue from other perspectives. Now, first of all, we are going to look at it from the perspective of the caregivers. Like Barbara said just now, we have other experts who will share with us their insights on other aspects. Now, let's start with caring for people with dementia. Now, first thing we may think about is stress, all right? Now, what is stress? Stress can be defined as when we encounter a situation, our physiological and mental situation, there's reaction. So that's called stress. Now, this kind of reaction, this response could be our body, our mind, or emotion, or behavior. And after encountering these things, we have responses. So one of the most important objectives is to ensure our own safety, to ensure our life. For example, if my life is being threatened, what will I do? For example, sometimes our behavior will change. So there will be a fight or flight behavior pattern. So these kinds of behavioral responses will ensue after we have encountered different situations. Now, the sources of these stresses, where are they? First of all, they're external. For example, natural disasters, force majeure, and there are also internal factors. For example, if you feel discomfort, if you have worries, you're depressed. So these will also give you stress. This could be real. For example, if the stocks have gone down down the drain and I've lost a few billions of dollars, so these are real stresses. Now there are stresses that may be preventable, so meaning that they have not happened, but we expect them to happen. So these also cause stress. So these different sources of stress, they may be different, but there's something in common among them. First of all, things that are novel. Second, things that you cannot predict, unpredictability. And the third thing is there's threat to your ego. And the last thing is that there's sense of low control. So if all these characteristics, if they are more obvious, then our stress will also usually be higher. So on the contrary, like if it's not novel, it's something that we see every day, like if it happens at noon every day, so it's not going to threaten me at all, so then the stress level will be lower. So let's go back to research. Some research has found that there's factors for caregivers' mental stress. So one of the stress factors is the caregiver's age. For example, there's the middle, caught in between level. For example, caught in the middle, meaning that there's a generation before you and the generation after, so you're caught in the middle. That gives you stress. And also the caregiver's own worries. This may also affect their stress level. And also the patient's dependability. If it's higher, if the level of dependability is higher, then the stress level is also higher for the caregiver. So there are other factors that we may not be able to prevent, for example, our own age. We don't live younger, right? We grow as we get older as we live. So, and also the dependability, that's something that we cannot always control, because the dependability may increase as time goes by. So that's something that we cannot have complete control. But if there are ways that we can find to control our own moods, maybe our stress level will not be as high then. So there are some health organizations which can help us, maybe give us an assessment on our family, so assess our family needs, and maybe give some family support, so that way the families can find it easier to deal with their stress level. So from the psychological perspective, something we're interested in knowing is the caregivers, their psychological needs, what are they? So we find that actually for the caregivers' psychological needs, there are myths surrounding those, and they're related. We realize that some caregivers, if they have these myths, these misunderstandings, misconceptions, their stress level would be higher. So on the other hand, if we understand more about these myths, or we can understand more of these unknowns, then there's we can deal with the stress better. So let's look about these myths. The first one is a lot of times, the myth that we believe in is that we don't want to increase our family's burden, and I am the only one who can provide care. Have you seen this before, right? So some caregivers, they they're the only one in the family who has to shoulder all the responsibility. So they would just leave their own worries behind and just shoulder the burden all by themselves. The risk for that is that the caregiver will, will be fatigued very quickly because he or she shoulders all the burden. So to care for someone who has dementia, it's like an ultra marathon, not just a marathon, an ultra marathon. So you have to pace yourself. You don't sprint 42 kilometers like in a marathon. But what you need is you pace. So if you pace, then chances are you can run longer. And now the second myth is a lot of times we see that is that if you want to take a leave and then you feel very uncomfortable, antsy, you feel guilty, right? So have this kind of thought crept into your mind? Well, some of the caregivers do think that. So they really take their job, so-called job, seriously. But some of the caregivers, they kind of feel too extreme about this. Even a respite or short rest, they think is something that is illegal, that's against their conscience. So the risk is that they get burned out very quickly. Another risk factor is that they will get tired about this job. Because they're burned out, they're sick, they're fed up with the job, this responsibility. So, and in the end, there could be more problems in their caregiving. So this is one of the very common myths. And the third myth is that, other than having guilt, self-guilt, they don't take a break. They don't want to take a rest. You know why? Because they are afraid. They fear that once they take a break, once they leave the patient, something bad will happen. Has that happened to you? Have you ever thought about this? If you were to ask me, Dr. Young, is anything bad that's going to happen? You know what? I would say for sure. If you were to ask me if there's any chance that something bad should happen, you know what? Anything is possible, right? So there's a chance you may win the lotto, and so anything can happen. So for us who are into psychology, one of the resolutions to reduce stress is to ask other questions, other types of questions to help you solve your problem. So the thing is not about whether it is possible, because everything is possible. Like I said, you could be a super 649 winner, but what are the probabilities? That's what it's all about. This is more pragmatic. So the questions to ask is not whether it's possible, but how probable it is. And then another myth is, a lot of times in our clinical work, is self-care means that I'm being selfish, especially when someone's sick and when during this difficult time, you even care about yourself. Isn't that being selfish, being egotistic? Now, like I said before, it's a marathon, it's an ultra marathon. So, you have to pace yourself. You have to leave enough stamina, energy for yourself so that you can run longer, so you can give care longer. So caring for yourself and taking a short break does not mean that you are giving up on the patient. It's just that you are stepping back a little bit, and then you think, is that a bad thing? Well, no. And let's look at this next myth The next myth is that, say, I can only be a caregiver. I cannot be anything else. No, right? No. Everybody plays different roles at the same time in their life. Caring for someone in the family is only one of the roles that we play in life. Caring for someone who is suffering from dementia does take up a lot of time, a lot of energy. Does that mean that this is the only role that I have to play? That I have to sacrifice all the other roles that I play in life, that I assume in life? No. Let's look at it from another perspective. If we could change our role, maybe the ability, the attitude that we take when we care for someone who is sick may be different. So we can get maybe inspiration, some revelation from playing other roles, so that when we take care of our family members, we can have a new perspective. Is that a bad thing? No. So you have to consider that too. And then the next myth is, if a patient is still sick, we should not talk about our own feelings. Someone would feel that if we talk about our own feelings at this time, it's not right, especially when the patient, it will give negative thoughts to the patient. So our brain is funny. Our brain is very complex, and we can have different thoughts in response to different experiences. So there's no right and wrong. There's no good or bad. Emotions, in the end, are just emotions, nothing else. If you're mad at someone, there's nothing right or wrong about it. It's just that your emotional response at that moment. If you're mad at someone, it doesn't mean that you have to slap that person's face. If you slap, that it's a behavior. It's a behavior that you choose to take, but the response you can choose. The behavior you can choose. So we should treat our own emotions from other perspectives to deal with our emotions. Even if we have to take care of someone, then these negative emotions will be lessened. That will help us care for the patient better. The next myth, and it's also a very common myth, is that if we have to move our patient, our family member, to a long-term care facility, we feel that I'm a failure. I'm a failure because I cannot take care of my own family. But is that a fact? Well, actually, really, it's not about the benefits, the pros and cons of keeping that person at home. It's for the benefit, for the interest of the one person who is sick. So you should look at if there are any medications to help relieve the symptoms, or it would be a miracle to have a cure for that. But when this condition progresses to a certain condition, there's no other alternative but to send this patient to a long-term care facility. So it's about the condition. It's not about your being a failure or not a failure. The next myth is that I have to make all the decisions for the caregiver, for caregiving. So there's no way that one person can make all the decisions. You need a whole team, a whole family, in order to give effective care. So we have to learn how to delegate decisions to other people. So when we do that, yes, of course, there are risks, because they may not do as good a job as you do. They may not meet your expectations. However, if one person is to make all the decisions, does that mean that you eliminate all the risk factors? No, that's not the case, because if you do all the decisions, make all the decisions yourself, then actually that's going to be a delay in coming with resolutions. And I'll just go quickly with the other myths because of time constraints. So this next myth is that, well, we hope that our family member can be cured very quickly. Although we don't want to give up, however, we should not always believe in those so-called remedies. Say if you spend a lot of money on things that have not been scientifically proven or empirically proven, so there are risks involved. The biggest risk is that the patient's condition will worsen. So the last myth is that you feel too busy and you don't have time to plan for your future because you devote all your time to take care of the patient. But does that mean that we should not take some time to plan about our own future, especially if you are caring for your spouse? So you think, oh, this is my spouse, this is my partner, I have to devote all my time for someone who needs chronic care. So, well, I hope that it's been useful for you to share, to sort of break these myths with you so that these misconceptions will be shattered when you care for someone who has dementia. Thanks for your time. Thank you, Dr. Young, for a very detailed talk. And I hope that what you have shared with us will help those who give care to just sit down and think about their own situations. Now, we have a poll question.
And we thank all the audience to pay attention to our program and to listen to all the specialists giving a lot of information. I would like to acknowledge a few of our partners. I would like to thank BC Health Ministry because of their support. And therefore, our iCON has been in operation for 13 years, and this is our 14th year. A lot of gratitude to them. And this one, please go to BC Health Ministry and go to the booth. So there is one which is the guideline for seniors, and you can download for them Seniors Guide, and they are in English and in Chinese. Two different versions. So please go and take a look. And then another slide, please. And there are a lot of community partners like Success, which is very important, and Alzheimer's Society BC. We have a lot of support for them. Vancouver Coastal Health and Canadian Health Association, a Canadian Health, British Columbia, and Villa Cathay, and Richmond Cares, Richmond Gifts, who is helping us. And there is a lot of media partners, Fairchild, Ming Pao, Sing Tao, Talent Vision, Fairchild Radio, South Vancouver Neighborhood House, Diversity, and IMC, and also Kawa Health Forum. And finally, I would like to give thanks to the health exhibitors. So remember, these health exhibitors are on for 1 month, and you can go through the Success, Alzheimer's Society, just like what I've said, the BC Ministry of Health, Family Givers, RCRG. I would like to also say Success and Alzheimer's Society. They are offering another forum, and then from our exhibition forum, you can find a poster. This is the one. So you can take up your phone and then take a shot of the QR code. If you're interested, I think there will be a lot of information to present to others. And finally, I would like to express our thanks to our guest speakers again. And you have been attracted by their excellent speeches. Dr. Tigerson Young, Wendy, our registered occupational therapists, Jojo Wang, registered dietitian, and Miranda Wang, community psychiatric nurse. And so the information is excellent and abundant. And we would like to thank C2 Sky Christina and her team to organize this virtual forum. Thank you very much for their technical support. And there are a few interpreters. So when you listen to the Chinese or the Mandarin, so you can listen to Shiny Tang Susan Yao. For English is Josephine So and Benny Loy. And thank you for the enthusiastic interpretation. And thank you so much. And finally, I would like to thank iCON team. Actually, behind the scene, there is Susanna Ng, there is Joanne Rockwood, Henry Soring. They have been doing a lot and having a lot of support to us. And there are many other volunteers behind the scene giving us a lot of help. And finally, I would like to thank Barbara. You have seen her performance in the past 2 days. So not just those past 2 days, there was a lot done by her preparing for the forum. And the most important, I would like to thank all of you, audience, because when you come to this forum, it's because you take very important perspective at your own health and the health of your family. And we really do wish that we have helped you to know more about dementia. And we do hope that we are going to hold more workshops on different topics. And we know that there are a lot of questions regarding dementia. We are going to hold a specific workshop answering all those questions. So please go on to our website, keep track of our development, and then you will be notified if you have already registered. And for online, I have to say goodbye for the time being, but I know we are going to have a good time down the road, and we are going to use time to help yourself and help each other so that we can live a very vibrant life. Thank you. Bye.